Hello there. I'm Michelle Bullock, licensed massage therapist in the state of Washington, and this channel is all about helping you to pass the MBLEx and become a licensed massage therapist. You've already gone through massage school, and now all you have to do is pass that test. In other videos, I go through a lot of specifics about each section of the MBLEx, what you need to know in those. Last week, we talked about some weird things that you need to know for the MBLEx, and one of those things being energetic anatomy. And I got a really interesting response from one of you viewers about how they took the test and they were surprised that there was a question regarding doshas in Ayurveda. And I was actually taken by surprise because I did get chakra questions, but I did not get dosha questions regarding Ayurveda. So I thought I should just go ahead and cover that, and then we'll know more about it for the future. Just in case you get a question regarding the three doshas, which are, they're energetic types, they're energy types. So in Chinese medicine, we're much more familiar with the idea of the elements being fire, air, water, earth, and ether, or the other stuff. But in Ayurveda, it's like a constitutional type that people have. So you're more like, if you have like a certain physical type, you're more likely to have this energetic constitution. And those are vata, pitta, and kapha. So vata is associated with air and ether, which is like space. They're airy people. It has to do with circulation, respiration, and nerve impulses. And then pitta is associated with fire and water. So it's about churning things, digesting things, chewing it up, creating something new out of it. And then kapha is about earth and water, which is like structure and stability. The philosophy in Ayurveda is that if you have a balance of these three different elements, then you're a healthy person. And if you get out of balance and you're leaning more into vata or leaning more into kapha, then you're going to end up with some health problems because of that. There are different types of bodywork in Ayurveda, and it has to do with balancing those doshas. So at specific points in the body called marma points, they can get energy moving just the same as in acupressure or acupuncture in Chinese medicine. The philosophy believes that different types of rhythmic strokes can get different kinds of energies moving in the body to balance those doshas out. And also medicated oils that have been infused with herbal medicine can help to balance out. Massaging them into the body can help to balance things out. And another question that we had was regarding the difference between endangerment sites and sites of caution. So I'm going to go over that with you. Just real quick, I want to just remind you that you can pick up a study guide for free. The link is in the description below, that I've created based on the Federation of State Massage Therapy Board's outline of what you need to know. I go into further depth in each section. So in the section of pathology, you can go through the list and check off everything that you've had a chance to study. So let's go ahead and get started talking about sites of caution versus endangerment sites. A site of caution is a place where extra care is needed, but it's still possible to massage on that site with modifications. So it's different than a contraindication. So some examples of where you can massage, but you have to be super careful. So the anterior neck, that's over here, the lateral and anterior neck, because we have these fragile structures. That's the larynx and the trachea. So we have to be super careful when we're massaging in there. So when I do massage, and I'm sure you've had this training in your massage therapy, at massage therapy school, is that we very carefully palpate for any pulse points, and we just carefully move around those, and then we slide back in under that trachea and larynx in order to be able to access those anterior cervical muscles. We have the axilla, which is the armpit. We have to be careful because there's the brachial plexus that runs through here, and we also have lymph nodes that can be pretty fragile. And it's especially important for individuals who've had any kind of breast cancer surgery or treatment. And then the medial upper arm, which is this area in here, if you just poke it, you can feel it. It's kind of tender. because we have an artery and we have the ulnar nerve. So the ulnar nerve comes down to the pinky and it runs up around the elbow and in here. So it's like, oh my God, that's my funny bone. If you poke it, you're like, what? You can feel it all the way down to your pinky. So that'll help you to remember to be careful when you're massaging that on people. We've got the popliteal fossa, which is on the back of the knee. I'm not going to stand up. I'm not going to show it. But the back of the knee, if you poke the back of the knee, it's like, oh, that's sensitive. So be careful because there's some nerves that go through there and there's also some blood vessels. And then in the abdomen, deep pressure in the abdomen, you have to be super careful unless you're trained in any kind of visceral massage, or if you're going to work into those structures on the lateral parts of the abdomen, including the psoas and the iliacus. So just be very, very careful when you're working on those muscles. So the best practices to have with that, using light pressure, knowing your anatomy, and communicating with the client if you're going to be massaging those areas. Now, endangerment sites are places where massage is just not safe, and you probably shouldn't massage at all. Sites of caution, be careful. Endangerment sites, just don't do it. All right. Don't massage on the carotid artery area. How do you know where that carotid artery is? You press in and you feel for a pulse. And when you feel that bump, it's like, don't massage on that. Move very carefully. This is where your palpation skills come in handy. You just move very carefully around it until you can find a place where you don't feel the pulse anymore. Don't massage the carotid artery. In the kidneys, in the kidney area, which is going to be in the upper lumbar, and then you move around to the side, you can feel the end of the muscle deep in there. Don't massage deep in there. There was once that I was working on someone's lumbar, and then I felt a lump that was next to their lump. And of course, when they came in, I was like, do you have anything new going on in your life that I need to know about as your body worker before we start on a deep tissue massage? She's like, no, nothing. And he goes to lay down, and it's like, I'm working on his low back, and there's a lump that's next to the lumbar area. And I'm like, so how do I say this without scaring him? There's a lump where your kidneys are. And this is different. I've never felt this before. He's like, oh yeah, I had some injections in my kidneys for testosterone. That would have been nice to know before I started doing deep tissue work on your lumbar area, because his kidney was very swollen and tender in that spot. So be careful when you're working lateral to the upper area of the lumbar muscles. Let's see. Xiphoid process and the floating ribs. So the xiphoid process is going to be down here. So we have to be super careful not to break off that teeny tiny little bone that's right in there. So be super careful if you're doing any kind of diaphragmatic massage. You're working around in here. You've got some very fragile floating ribs right there. Oh, I can feel mine sticking out. You can just feel like a little pokey poke if you're very, very careful palpating around the sides. Those are very fragile places. They're sensitive anyway. Your clients aren't going to like it, and they probably won't really like diaphragm massage anyway. But if you're working on somebody's diaphragm to try to increase awareness for their breathing, release restrictions, be super careful here. Be mindful and nice. Don't be mean to them when you're working on their actual diaphragm, and then just don't massage all the way out here at all where you feel the bony structures. Those are the floating ribs. And then eyes. Don't massage in people's eyes. That sucks. All right. I don't think you need me to explain that. Nobody likes that. So the reason that we avoid that is possible damage to nerves, arteries, organs, and you could seriously injure someone. Okay, so it's really important to understand the difference between a site of caution and an endangerment site. Site of caution being careful, endangerment site meaning don't massage there. So it's really important to know the difference between that for the MBLEx. It's kind of an important distinction. So they're probably going to ask you which one is like a site of caution and which one is an endangerment. Pop quiz about what I just talked about regarding sites of caution and endangerment sites. So the abdomen, what is that? Is that a site of caution or an endangerment site? The abdomen in the belly. That is a site of caution. If you are trained in visceral massage, then go ahead and carefully work on those abdominal muscles. If you're not, don't work deeply and don't go crazy in the abdomen because you could injure the organs. And then another one would be the anterior lateral neck. Is this a site of caution or an endangerment site? Well, if you're on the carotid artery, if you can feel the carotid artery, that's a big no-no. Don't push on that. But if you can, this area right here, for example, our sternocleidomastoid, I like to give that a little bit of a squeeze in clients who trust me and actually need it. If I give their sternocleidomastoid a little squeeze here, I can feel it there, and it's really releasing that fascia on the back of my skull. It's so good. As I start pressing in, I'm feeling for a heart. If I feel a heartbeat, that's the carotid artery. If I keep pressing that, they're going to black out. Not cool. So yeah, don't press on the carotid artery. And so the carotid artery is an endangerment site. The anterior lateral neck is just a site of caution. Be careful when you're doing it. But don't be like, I'm going to use deep compression. Don't use your elbow in there. Bad idea. So that's the difference. Now, pop quiz on the upper lumbar and flank. Why don't we use deep pressure in this area right here? Because first of all, we have the floating ribs. That's an endangerment site. Don't do it. And we have the kidneys, an endangerment site. So when we're working around here, we try to just kind of work in diagonally on these ESG muscles, working on some of the fibers of the latissimus dorsi, but we're not going to be going deep under the ribs. We're not going to be pressing on the ribs themselves. Okay. And then let's do a pop quiz also on the doshas in Ayurveda. So we have Pitta. What is Pitta in Ayurveda? That would be fire and water, which is all about digestion, composting, churning things up, metabolism, body temperature. So it's like all about the fire and the energy that creates life. And then we have the other ones. That's Vata, which is air, and Kapha, which is earth. All right. Now, let's see what else I have. Okay, so now we're going to do some MBLEx style questions, one for each topic of the MBLEx. And we'll just go over each one, try to eliminate what it probably isn't, and discuss why. So the first question we've got, while performing a Swedish massage, a client requests deeper pressure in the popliteal fossa. Which of the following is the most appropriate response by the massage therapist? So we just talked about this, didn't we? Deep pressure in the popliteal fossa. This isn't something that I've experienced before. I've actually had new clients come in and be like, please don't massage the back of my knees. I'm like, don't worry, I won't. So we just talked about this in the pathology section. So this is a pathology question. It's what can help us to remember what the answers could possibly be is to try to isolate each of these questions into which section of the MBLEx it would fit into. That's a really interesting way to just master these questions. So, which of the following is the most appropriate response by the massage therapist? So our choices are A, apply firm pressure to relieve tension in the hamstring tendons. That's just not very comfortable for people. If any of you viewers have had the experience of being able to work on those hamstring tendons around the popliteal fossa without it being uncomfortable or have a really good reason to do that, I'd love to hear from you. But I've never experienced a client that enjoyed that in any way. So what I do is I just use some compression and some pin and stretch. I might do very gentle pin and stretch in that area, but I'm not going to do friction or anything like that. Or we have B, use light pressure and avoid deep work to protect the vessels and nerves. This is a good choice. It may not be the right one yet. We're still going to read through the other choices, but light pressure and avoiding deep work, protecting vessels and nerves. That's really important for sites of caution. So C, apply deep friction to improve circulation through the area. So no deep frictions for the circulation. Or D, avoid all contact with the area as it's considered an endangerment site. So starting from B, use light pressure and avoid deep work to protect the vessels and nerves. I like that. Light pressure, avoiding deep work, protect the vessels and nerves. These are all really important aspects of sites of caution because popliteal fossa is a site of caution, not an endangerment site. So C, apply deep friction to improve circulation. I don't like that one. It's not going to work. We just talked about that. And then D, avoid all contact with the area as it's considered an endangerment site. It's not considered an endangerment site. Sometimes people do need some hamstring work. But yeah, let's see what I wrote. So the popliteal fossa is a site of caution, not a full endangerment site. It contains the popliteal or popliteal artery, vein, and tibial nerve. So deep pressure is unsafe, but light superficial techniques are acceptable with caution. All right, let's see if you can guess which section of the MBLEx this question belongs in. A massage therapist frequently shares personal stories with clients and often accepts invitations to socialize outside of work. Which type of professional boundary is the therapist most likely demonstrating? So we have, first of all, what section does this belong in? Ethics. So we have A, an impermeable boundary, B, semi-permeable boundary, C, permeable boundary, or D, flexible boundary. Now, in our studies in ethics, we learned about different kinds of boundaries, the impermeable boundary being the firmest one. These are my hard rules. I will not go outside of that. I will not do anything that I will not go outside of these personal rules that I've decided on, or these, like, I will not go outside of these personal rules that I've decided on. The semi-permeable boundary means you may be able to make some adaptations depending on the situation. And then C, permeable boundary means you just let your client walk all over you. You have no boundaries at all. And then flexible boundary isn't one of the choices. We just have the three, the three ends of the spectrum when it comes to boundaries. And so I'm thinking it's B. I'm going to eliminate impermeable boundary because, oh wait, what was the question? The question is the client frequently shares personal stories. Okay. Is that something that we do as massage therapists? And often accepts invitations to socialize outside of work. Is that something that we're supposed to do as a therapist in the therapeutic relationship? Because that would demonstrate a dual relationship that you're going into. Semi-permeable is the ideal, but this massage therapist is demonstrating a permeable boundary because they have there's nothing, no wall between themselves and their clients because they're sharing everything about themselves with their client. So that would be a permeable boundary, which allows excessive personal information or personal involvement to cross the professional line, which can compromise the therapeutic relationship. Impermeable boundaries are too rigid, blocking necessary rapport and trust, and semi-permeable boundaries allow appropriate limited sharing while keeping the focus on the client. Next question. See if you can figure out which section this one belongs to. A massage therapist is working with a tall client in the prone position on a standard height table. The therapist noticed that they are hunching their shoulders and leaning forward to reach the client's far side. Which of the following adjustments would best support proper body mechanics and reduce the risk of injury to the therapist? What section does this question belong to? I think it belongs to guidelines for professional practice, because that one is just all about how to be a massage therapist safely and professionally. So our answer choices are widen the stance, bend more at the waist, and keep working from the same side of the table. Let's see, bend more at the waist. Wait a minute. Let me just see the other choices. B, lower the table height so the therapist's hips are slightly above the table surface and move around to the opposite side as needed. Okay, so you can lean more out. Okay. And if you lower the table height, you can reach a little bit further. So C, stand on a stool to better reach across the client's body from one side. That's not a good choice. We can eliminate C, so that's not going to be one of them. D, place more pressure through the arms and shoulders to avoid moving the feet during massage. We know that D is not a good answer because when we're using proper body mechanics, we're leveraging our body weight, and using our arms and shoulders causes a lot of damage to our arms and shoulders in the long run. So we've just eliminated 50% of the choices. Now we only have to choose between A and B. Widen the stance, bend more at the waist, and keep working from the same side of the table. I don't like that as much as B, lowering the table height so you can reach better, because bending at the waist can cause a low back discomfort. Let's see what I wrote for the rationale. So B is the one that I chose. Proper body mechanics involve working with a neutral spine, that means not bent, using leg movement instead of leaning, and adjusting the table height to allow the therapist's weight to transfer efficiently. Lowering the table slightly and moving around the table prevents overreaching, reduces strain, and maintains optimal ergonomics. And just real quick, I have just a little bit more housekeeping to present to you besides getting the study guide. I wanted to make sure that you know that you have access to a free 100 question practice test. It's not this one. I keep showing you guys test 2 because test 2 is part of the 10 test bundle that's available for purchase. But you can get the first one, test 1, for free. It's 100 questions, multiple choice, exactly in the format that I'm presenting to you. This is the exact format that the MBLEx is presented in. It's a question. You've got 4 choices. You have to choose the best one. None of them are going to be all of the above. And so what you do is you print the test up, or you can have it on your device if that works better for you. And you go through and choose the answers, or you set a timer for 110 minutes, and then you go through and choose your answers. And then when you're finished, you go through and check your answers, and you learn just as much from what you got wrong as you do from what you got right. It's another way to study. For me, it was a better way to study, was to practice doing test questions over and over again. And then at the very end of this free packet that you can get, in the description below is an answer key where each section is laid out. And when you have a lot of circles, meaning you got them wrong, then that means you need to spend more time studying that section. That way you don't study too much, right? You don't keep studying things that you already know well. But yeah, if you love that test 1, the 10 test bundle is available for purchase on my website. And all of that, the links to that is in the description. And if you are totally brand new to this whole MBLEx process and you want to know exactly how it works, or if you've been out of the loop for a long time and you finished massage school, you've been out of the loop and you're ready to go ahead and take your test, but you can't remember the steps, I have a little mini course in how to apply for the MBLEx and what to expect on test day. So that is free too. The link is in the description below. You go to a link tree and then it'll take you where you need to go. Okay, so that's done. Let's go ahead and finish up these questions. Put my coffee over here. What section within a synovial joint reduces friction between the articulating bones during movement? So a structure in a synovial joint, which is all of the really movable joints in our body. That's kinesiology. Under the kinesiology section, you'll find the outline of what you need to know. In the study guide, under kinesiology, you'll find joints is in there. So learning all about joints is in the kinesiology section. So synovial joint, what structure in the synovial joint reduces the friction between the articulating bones? So you have bones that go together in a joint and they move. So what structure is in the middle between those moving bones? Here are our choices. A, synovial membrane. B, articular cartilage. C, ligaments. Or D, meniscus. This could be pretty tricky for people. So I know that C, ligaments, is not the choice because ligaments hold the bones together and they kind of go on the outside. There's a couple that might cross. For example, the cruciate ligaments, they kind of cross knee joint. But generally, ligaments are not for reducing friction. The synovial membrane is the packet that goes around the whole joint. So I know it's not that. So we've eliminated A and C. So D, the meniscus, acts more like a cushion, and it's less about, the meniscus is the pillow inside of the joint capsule, but it's not for reducing the friction when the bones are possibly rubbing together. So by default, it should be the articular cartilage, which is like a rubber gasket in between the joints. And here's the rationale. Articular cartilage is a smooth cushioning tissue covering the ends of bones in a synovial joint, reducing friction and absorbing shock. Just going through all the other choices, the synovial membrane produces the synovial fluid to lubricate the joint, but that's also the packet around. Ligaments connect bone to bone, providing stability. a meniscus in certain joints like the knee add cushioning and stability, but is not present in all synovial joints. Ooh, that's a difference too. So the meniscus is not present in all of the joints, but a articular cartilage is. Okay, so this one, let's see if you can guess which section this question is from. During an intake assessment, a massage therapist observes that the client's right hip drops noticeably when they step onto their left leg during walking. The client reports occasional low back discomfort, but no acute injury. Which of the following treatment approaches would be most appropriate? So we've got intaking, you're doing an intake, you're looking at your client, and you're noticing certain things in how they walk. They report da-da-da-da-da-da-da, and then you have to make a plan. What section would that question go in? Client assessment, reassessment, and treatment planning. Okay, so let's imagine that you are in the test scenario and you're reading this question. What I would do, what I did when I was taking the MBLEx, is I imagined that I was that client. Okay, so I'm like reaching over to my left. Which side is my left? Oh, it's this side. So I go to my left hip and I'm like, okay, the left hip is like dropping. So I'm like, you can stand up. You're gonna like catch some people's attention. You can stand up. You just can't like write like stuff. I don't think so. I didn't get a pencil and paper, but so you're imagining their hip is like, oh, it's weak when they're walking. So their hip is weak. That means the right side is going to be overcompensating. So like any way that you can imagine that, either by standing or just by just like reaching over and feeling your left, feeling your right, this will help you to be able to really get into the question. So A, focus on deep friction massage to the lumbar erector spinae to release tension. They will probably appreciate that. Bilaterally, it'll probably feel pretty good as long as they want deep tissue. But that doesn't necessarily address the hip issue, does it? B, apply deep tissue massage to the gluteus maximus bilaterally for increased strength. That's probably not what I would do. So what does deep tissue massage do? It releases restrictions and increases blood flow, but it's not necessarily going to wake up those glutes to increase the strength, right? So I wouldn't choose B either. I don't think that's the best choice. And C, use myofascial release and trigger point work on the left glute medius. Where's the glute medius? So we know we've got the glute max, covers the whole backside. Glute medius is only going to be like over here on this part of the hip. So kind of to the most lateral part and kind of going toward the middle, about halfway between the lateral part of the hip and the gluteal cleft. So it's about halfway there. And it helps with abduction and also extension of the hip. So myofascial release and trigger point work is going to release any kind of restrictions that are happening that are keeping that muscle from being able to engage. So this is a possible choice. On the left also is what we're saying. And then D is perform aggressive cross-fiber friction on the iliotibial band of the right leg to balance the gait. And I don't think that's the best choice either. We have to choose the best choice. We have to make the best choice. And this is a really, really good question because this question really does simulate integrating so many aspects of massage therapy into the client assessment area of the test. So I think the best choice for this would be C, to try to work out any kind of restrictions that are preventing that glute medius from being able to engage. And then I would go through and from that point, I would do some kind of stimulating work on the glute max to encourage it to wake up and do its job. The rationale is that hip drop on one side during gait often indicates weakness or dysfunction in the glute medius on the opposite side. Massage therapy can help by releasing restrictions, reducing tension, and addressing trigger points in the affected muscle to restore balance. So, can you guess which section this question is from? Which statement correctly describes the direction of blood flow in the following vessels? So we're talking about blood flow in the vessels of the body. That would be the cardiovascular section of anatomy and physiology. So let's go through that question one more time. The direction of blood flow in the vessels that they're about to describe. So we'll think about that. The pulmonary artery carries oxygenated blood away from the heart, and the pulmonary vein carries deoxygenated blood toward the heart. So we're going to be talking about the pulmonary artery and the pulmonary vein. So let's just go over that real quick. Arteries carry blood away from the heart. All arteries carry blood away from the heart. So just because the blood has gone through the heart and is not still going out to the body doesn't mean it's not still an artery. So deoxygenated blood goes through the heart and gets pumped away to go to the lungs. That makes it an artery because it's going away from the heart. That's the distinction. I used to think that an artery meant it's the blood that's going to the body, and that's half of the story. There's also the blood that's going to the lungs. So anything that's going away from the heart is an artery. Anything that's going to the heart is a vein. So even though the blood is oxygenated going to the heart from the lungs, it's still considered to be a vein. So blood that's going from the heart to the lungs that's deoxygenated is going to be an artery. Blood that's going from the lungs to the heart that is oxygenated is a vein. So the pulmonary, which means between the heart and the lungs, the pulmonary vein has oxygenated blood. The pulmonary artery has deoxygenated blood. All right, so let's very carefully look through these choices. The pulmonary artery carries oxygenated blood. That's not right. B, the pulmonary artery carries deoxygenated blood, okay, away from the heart, and the pulmonary vein carries oxygenated blood toward the heart. I would put a little circle around that. But if I was in the test scenario, I wouldn't be able to circle it, but I keep that in my head. So we've eliminated A. C, both the pulmonary artery and pulmonary vein carried, no. D, both the pulmonary artery and pulmonary vein carried, no, it's B. All right, we're just going to go past that explanation because we just did that. One more question. What section of the MBLEx is this from? A massage therapist plans to apply moist heat to a client's lower back to help tight muscles before starting the session. The hydrocollator pack has been stored at 170 degrees Fahrenheit. Which of the following is the safest course of action? Which section does this go under? It goes under the benefits and effects of massage, under the section of hot and cold therapies, because in that section, we learn about the benefits of using heat, using cold, the effects, and the contraindications. All that goes under the section of benefits and effects of massage therapy. So here are our choices. Go once again. Hydrocollator pack, that's hot. Stored at 170 degrees Fahrenheit. That's really hot. Now, hydrocollator packs, in case you weren't trained in this in massage school or you've forgotten, they're typically go in a range between 150 and 170 degrees. I have found in a clinic before that there was a hydrocollator pack that was 180, and then I was like, whoa, that's too hot, and then I had to dial that down. 170 degrees is really, really hot. You need to put as many towels around that as possible before you apply it to a client's skin. 160 is a lot better to use two towels. So your choices are A, apply the hot pack directly to the client's skin for maximum heat transfer. Now, there are some clients that will say, give it to me hot. I want it really hot because they think it's going to feel good. But 170 will burn their skin. So don't do that. B, wrap the hot pack in several layers of towels before placing it on the client. I like that choice. C, cool the hot pack below 100 degrees before application. Our body temperature is 98 degrees. That's not going to make a huge difference to the client. It's unsatisfying. And it's not going to cause those benefits of vasodilation that we want when we use heat. So avoid the hot pack entirely because 170 is too hot for therapy. That might be the case if you don't have enough towels and if you don't have time to wait for it to cool. You want to wrap it in towels anyway because that's gross. You want to be able to take the towel off, wash it, have it cleaned properly, and then use a fresh towel every time because using that heat on somebody's skin, it'll get nasty. So you want to wash that anyway. All right, your correct answer is B, wrap the hot pack in several layers of towels. Okay, so that's it for us for today. Thank you so much for tuning in. If you love this video, make sure that you subscribe. Please give a thumbs up. I appreciate that so much. Get your freebies down below. Keep watching for more videos. think this week is going to be about the most important non-technical topics for the MBLEx that accounts for almost 50% of the questions that you're going to get. Stay tuned for that coming up soon. And with that, Toodaloo.